Ketamine therapy for addiction, an overview. I'm Dr. Sundy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. I'm going to discuss ketamine therapy for addiction and what the evidence is and how it's used. So we know from studies by Dr. Krupitsky from some 30 years ago that ketamine psychedelic therapy could be effective for alcohol use disorder. And Dr. Krupitsky did these studies in a number of different sites. I published this information in 2011. And basically, he demonstrated that the effects of ketamine with psychotherapy could actually result in somewhere around 66% of alcoholic patients in the ketamine psychedelic therapy group to have response and abstinence for over a year in 111 subjects. So 73 of them, after this treatment with ketamine and psychedelic ketamine therapy, actually had abstinence compared to 24% of patients with just conventional treatments. And so the way that this whole study was designed was basically to initially prepare the patient by emphasizing the positive value and meaning of a sober lifestyle, and then emphasizing the negative aspects of alcohol abuse. And during the dialogue, what they would do is just help the patient kind of realize, okay, well, this is bad and this is good. And that was just kind of preparatory sessions. I think a lot of individuals probably recognize some of that information, but it was just, again, to kind of rehash it and get it in the forefront of their memory. So that way, whenever they actually did the series of ketamine treatments, then they would actually be thinking about these concepts potentially. So they were using intramuscular injections of ketamine for the sessions. And basically what they found was that, compared to standard alcohol treatment, that these ketamine injections with integration seemed to result in significant response. And so what does ketamine psychedelic therapy do exactly? And basically what Dr. Krupitsky felt was that there was basically this positive transformation of a self-concept that would occur, and that the individual was able to kind of see themselves in a better way, in an unconscious, nonverbal way, and that they had basically positive emotional attitudes to themselves and other people around them. So they kind of changed the way they viewed the world and thought outside the box, and saw more positive changes in their life values and their purpose, with more insight into the meaning of life and an increase in spiritual development. It sounds like the 12 steps in some ways, which again, ketamine kind of just brings this to the forefront for these individuals, again, by creating this neuroplasticity and this cross-connectedness inside the brain of conversations in areas of your brain that generally don't speak together when we're not using a ketamine type treatment. And they did notice that EEG computer-assisted analysis demonstrated that there were definitely increased activity in key areas of the brain of alcoholic patients when they were being treated with ketamine therapies, and that this also played a role in improvement. And so what does a psychedelic experience do? And so when somebody is having a psychedelic experience, it's felt, and this is according to MAPS and their studies, is that it contributes to the cathartic process, this kind of clearing out of all the old trash inside our brains, and allows us to stabilize the positive side of our brain. Because again, we tend to always emphasize the negativity, and that's the way our brain works. It always wants to emphasize that negative side, the negative self-talk, low self-esteem, self-sabotaging behaviors, and ruminations. And the more positive things always just kind of get thrown away, because more likely we're going to have something harmful in our lives than we are something good. And so what the psychedelic experience does is it kind of stabilizes those positive changes. It also enhances personal growth and self-cognition, allows you to see yourself in a better way. We have a better way of seeing ourselves inside the mirror and recognizing the positivity that we offer and bring to the table, and the positive things about ourselves. And also gives us more meaning to ourselves and the world, and that we are connected in the world, as well as increasing our creativity. Again, neuroplasticity and increased glutamate activity with neuroplasticity is all about learning. Glutamate is the molecule of learning, the neurotransmitter of learning. And when it's present for brief periods of time, it allows neurons to connect together, and that makes us excited about learning. It is a way of us to learn and have creativity and hope also. And also, we do broaden our spiritual horizons, as that sense of connectedness and larger worldview besides ourselves. It allows us to kind of get rid of those encapsulated feelings and beliefs that we just kind of, default to, which is, bad habits and negativity, and kind of break outside of them. It also allows us to harmonize relationships with the world and other people as well. So there's been a number of different studies out there for ketamine treatment and preventing alcohol relapse outside of Dr. Krupitsky's work. And this one here with Grabowski in 2022 basically was ketamine therapy for alcoholism. And it was a double-blind, placebo-controlled phase 2 clinical trial. And they used 96 patients and had alcohol use disorder patients who were severely affected, randomly assigned to a couple of different conditions. And they used 3 weekly ketamine infusions in one set of them. And they used a higher dose than initially would be used. So it's 0.8 milligram per kilogram IV over 40 minutes, plus psychological therapy. They did have placebo groups with psychological therapy. They just had some ketamine infusions with just some basic alcohol education, and then just some infusions of saline, which are the placebo, and a little bit of alcohol education, so they could compare all the groups together. What they found was there was a significantly greater number of days abstinent from the alcohol in the ketamine group compared with the placebo group at a 6-month follow-up, somewhere around a 10% difference. So ketamine therapy, the infusions with psychological therapy, outmatched any of the other treatments and the placebo as well. And so this was called the CARE trial, and it was the first one to compare ketamine with and without therapy in any mental health context. So, this again is the same Grabowski study in January 2022, and what they found was that people who had ketamine combined with psychotherapy, they stayed completely sober for 162 of the 180 days in the 6-month follow-up period, representing an 87% abstinence. And this group was more than 2.5 times more likely to stay completely abstinent at the end of the trial than those in the placebo group. And this is a better response than any traditional FDA-approved group of medications, whether it's oral naltrexone or injectable naltrexone or acamprosate or Antabuse. Basically, you're getting fantastic results with this. And then patients also with ketamine therapy had lower depression after 3 months and better liver function tests than those on placebo, meaning that their liver functions returned to normal after having been poisoning themselves with alcohol. And that was improved whether it was combined with therapy or not. So depression, was improved without the therapy in the ketamine group. And likewise, those with the ketamine with or without therapy had lower liver function tests, meaning they drank less. And so basically, this effectively cuts the risk of death from alcohol-related problems from 1 in 8 to 1 in 80. So it's a tenfold improvement. So what they felt was ketamine induces a sense of being outside of your body, and it stimulates this observer state. You can see yourself or what you're doing, and you're like, well, what's the point of me drinking? Why should I do that? It just doesn't make any sense. It doesn't jive with my feelings of the way I connect with the world. And so you can basically increase your mindfulness, your sense of being in the moment and taking appropriate steps and treating your body appropriately by not drinking. And that said, basically individuals were changing their relationship with alcohol and with themselves. So there were further studies as well, in this one in particular by Ravi Das and his group in 2019, published in Nature, that ketamine can influence basically a decrease in alcohol use by rewriting drinking memories. And in this one, what they found was there are maladaptive reward memories that are involved with the development and maintenance of acquired overconsumption disorders, such as alcohol and even drug use. So you kind of pair your drug with specific memories, sounds, places, cues and triggers, and then you begin to encapsulate these into behaviors and into habits. And of course, habits are really hard to break. You're not really spending any focused energy on them. It's a default mode of behavior. And so we are having more and more difficulty thinking outside the box when we develop these maladaptive reward memories. So we're just like, well, let's just keep drinking. Let's just keep using substances. And we see this as really a common denominator in all substance use disorders. And basically, there's a process of memory reconsolidation that when stored memories are kind of brought back to the surface, they become briefly labile upon retrieval. And this offers a means to disrupt these maladaptive reward memories and prevent relapse. And that's what this study was all about by Das and his colleagues, that effectively by retrieving these memories and giving them ketamine, you could effectively reduce the reinforcing effects of alcohol and long-term drinking levels compared to ketamine alone or retrieval alone. So basically ketamine and also this retrieval process allowed us to kind of rewrite drinking memories. And so these adaptive reward learning processes that control motivated behavior can be actually usurped, they can be changed, and they can be changed by addictive drugs. And it just kind of forges harmful drug use and behaviors, and they begin to be encoded by maladaptive reward memories, which is basically habit. It's basically something that we just encapsulate. And habits are easier for our brain to kind of process this information, and just to kind of do less energy of thinking to do it. So that's why we can just sit there and talk to somebody and just slam down drink after drink, is because it's just kind of built in as a habit. We don't have to think about it. The same thing is when you wake up in the morning. It's not like you have to learn how to talk again or walk again, or even catch a ball. Those are basically things that are translated into habits so that you can focus on new learning. And so maladaptive reward memories are old learning that are just kind of translated into habits. And so we have to unlearn these habits and to prevent problematic drinking, because there's cues and triggers that can lead to us drinking and to lead to us unknowingly starting to drink. Like you get home at the end of the day and you instantly think about reaching for that beer, and you don't even think about it, you just do it. And that's also a phenomenon we see with even food. Every day you're driving by the same road and there's a Dunkin' Donuts on the side of the road, and you're immediately going to go there because you're hungry. And after a couple times of doing that, it just begins to become a habit that you have to actually think about not doing. So current treatments such as cognitive behavioral therapy or cue exposure therapy do not involve unlearning of maladaptive reward mechanisms. And basically, the important thing is that you have to unlearn these things as opposed to suppressing them. Suppressing is very hard. And suppressing is hard even in diets, for example. For example, if you're hungry all the time and you're working in a donut factory, and you're trying to lose weight and you haven't eaten for hours, it's just going to be a matter of time before you're going to grab a donut, because it's hard to suppress the hunger. It's hard to suppress the craving, and those are part of maladaptive reward memories. So basically, the use of ketamine can interfere with these maladaptive reward memory reconsolidation. So you just give the person ketamine and you basically rewrite that memory by giving specific verbal treatments, psychotherapy type treatments, to kind of help avoid that reconsolidation of harmful memories. And they found that basically with this treatment that there was a rapid and lasting reduction in the number of drinking days per week and the volume of alcohol consumed in the ketamine, followed by maladaptive retrieval mechanisms and destabilization, and that there was no rebound to baseline, at least for 9 months after the manipulative therapy. So basically, we can interfere with this maladaptive reward memories and kind of reframe them in a way that allows us to live without the substance and without the habit, and to reduce our reactivity and responses and emotions to alcohol cues. So it reduces the motivation to drink and to decrease the amount of drinking we do have when we do drink. So there was also further studies showing that even a single ketamine infusion combined with motivational enhancement therapy for alcohol use disorder could also be effective. This was by Dakwar in 2019, where basically they randomly assigned patients to a 52-minute IV infusion of ketamine at 0.71 milligrams per kilogram. That's kind of a specific number. I'm not sure like at the 1/10 of a milligram per kilogram in there, but they did. And they did 17 patients, and they had it compared with an active control of midazolam, which is Versed. It's like a benzodiazepine like Xanax, given it as an IV. And they had 23 in the control group. And basically, they provided a 5-week outpatient regimen of motivational enhancement therapy to kind of, get ways to motivate people to kind of change their behaviors. And basically, they found that ketamine significantly increased the likelihood of abstinence and delayed the time to relapse and reduced the likelihood of heavy drinking days compared to the Versed placebo group. The infusions were well tolerated and there were no adverse events that caused people to stop. So over the 3 weeks after the infusion, there was a lower likelihood of drinking and a longer time to relapse. So again, more evidence that ketamine therapy, ketamine mixed with specific types of psychotherapy could actually improve patients' alcohol use and diminish alcohol use disorder. So Dr. Krupitsky has done a number of studies and combined psychedelic therapy and aversive approaches with alcohol treatment. And even combining ketamine with aversive therapy approaches demonstrated that by creating negative links between alcohol consumption and basically alcohol's use and the detrimental effects of its use, that 70% of the patients remained abstinent at 1 year compared with 24% of those were given aversion therapy alone. So again, it's kind of a rehash of Dr. Krupitsky's information earlier with ketamine psychotherapy and its results of ketamine in alcohol use disorder. So there's also been studies about ketamine therapy to decrease cocaine use. There's not a whole lot of treatments that are available for cocaine use disorder, maybe motivational enhancement therapy and psychotherapy. Just the just stop type of therapy is the only thing available. There's no real medications that definitely are proven to work well for cocaine use. But there are reports and definite evidence that you can actually use subanesthetic ketamine infusions and decrease cue-induced craving in cocaine-dependent research volunteers. And this was a study by Dakwar in 2013, where effectively he used cocaine-dependent volunteers who were just randomly taken, and they weren't like people trying to quit, and they gave them a single dose of ketamine, 0.41 milligrams per kilogram, and did that over 40 minutes. And they found that it increased the motivation to quit cocaine and reduced cue-induced craving significantly more than Ativan placebo at 24 hours follow-up. So they used 8 volunteers with a definite diagnosis of cocaine dependence, and they weren't seeking treatment. And they did basically 3 52-minute IV infusions, and they did it at lower doses and higher doses. And then they used Ativan as a placebo agent. And basically, they separated the infusions by 48 hours. And they noted that even the 0.41 milligram per kilogram ketamine dose led to a mean decrease in cocaine use. And also, they noted that there was a decrease in cue-induced craving as well. And so, effectively, a single ketamine dose of 0.71 milligram per kilogram could reduce the choice of cocaine self-administration versus something else like money. If you offered people money versus cocaine, people would actually take the money, versus cocaine, and just by receiving a ketamine dose. And they compared this with Versed in 20 cocaine using individuals. And in this particular study in 2016 by Dakwar, basically they found that ketamine was able to decrease, individuals' preference for cocaine. And again, it was somewhere around 67% relative decrease to baseline at 24 hours post-infusion. So in 2016, Dakwar takes 20 non-depressed cocaine-dependent individuals and hospitalizes them and basically does this to control the environment and then treat them, and then see what happens when you release these individuals into the wild. And they found that in these individuals, ketamine led to a decrease in cocaine choices even as soon as 28 hours post-infusion. Somewhere a multiple fold decrease in cocaine use, some 67% baseline reduction, and that there was ketamine leading to a significant reduction in cocaine use initially, but after about 7 days, 10 days, there was basically a decreased separation between ketamine and the placebo. So the effect does run off after a period of time. So it sounds like, with cocaine use, you may need to have periodic infusions to kind of make this process happen. And there are no follow-up studies where a series of ketamine infusions over extended periods of time were proven to decrease cocaine use, and even the ability to do microdosing or home-based ketamine as an intranasal oral. There's no studies on that as well. So we know that ketamine reduces cocaine craving based on these studies here. And this has also been seen on clinical settings as well for patients that are treated for cocaine use disorder and have received ketamine, that there is actually a decreased preference for using ketamine and decreased relapse. So ketamine may have enduring effects on problematic behavior and decision making, and that it also helps reduce dysphoria, which is kind of a low mood as well. So ketamine helps out with mood disorders, helps out with depression in rapid fashion. We have discussed that in prior videos. And we also have found that ketamine decreases drug craving, and also it gives a better sense of delayed discounting, the ability of seeing the value of taking something for a later increased value versus an immediate reward. So in other words, basically ketamine allows you to see the value in just waiting before you do something, and gives you the ability to delay your choices for a greater reward at a later time. And we see the same thing with depression, that ketamine helps improve delayed discounting. So individuals can get out of bed and brush their teeth, because brushing your teeth isn't exactly rewarding, but when you get depressed, you stop doing it. You stop self-care because there's no immediate value. It's something you get later on, that there's some positive reward by brushing my teeth. I save my teeth for my ability to eat a steak in 2 or 3 years, but that's a later reward. And delayed discounting goes away when you're depressed, but it also goes away with drug use, because your brain begins to think more like a lizard brain, like immediate rewards. If it's not going to be an immediate reward, you're not going to do it. And so motivation gets much lower in drug use, just like it does in depression. And there are similar areas of the brain that kind of make this happen. So ketamine has the ability to reverse this. And ketamine also decreases, based on one study, amphetamine-related distress by normalizing the nucleus accumbens dopamine neurotransmission through downstream activity. And there's reference to a study on the lower right of the screen, where basically people who are withdrawing from acute amphetamine, basically that they have a lot more reward value after ketamine treatment. And likewise, they noted that ketamine may disrupt alcohol consumption because of a neuroplastic mechanism. And this involves mTOR, which we address in other videos, that basically mTOR activation is required for the anti-alcohol effect of ketamine. And mTOR is involved with protein production in the neurons, and those proteins are involved with the production of dendrites. Dendrites are where new connections are made in the brain, which is neuroplasticity. And so there's also a question of the psychoactive effects in cocaine use, and whether that is a key impact on decreasing cocaine use. And in this evaluation by Dakwar again, and this is 2018, that basically the mystical effects seem to provide anti-addiction benefits of ketamine based on his studies. And so there's been this goal of researchers and a lot of other people to create ketamine-like substances without psychoactive effects, because they're worried about abuse and misuse or behavioral toxicity. And there's evidence also that says that the mystical experience could mediate the effect of ketamine on craving and cocaine use in dependent people. And this was based on their studies on follow-up scales, for patients who get dissociated or have the ketamine experience and the mystical experience, that basically they found that those with the more mystical experiences had lower cocaine use and lower cravings after ketamine infusions. And that this may actually mediate the effect of global improvement over the post-infusion period with ketamine. So having that mystical experience with ketamine infusions decreases cocaine use. So effectively, we know that repeated drug consumption may cause these neuroplastic adaptations that change the way that our brain sees ourselves and sees the world, and encapsulate certain behaviors that are maladaptive, meaning they're just the wrong answer for everything around us, and they result in bad outcomes. And this is why patients with addiction problems tend to choose the same situations over and over again, even though it's not the best outcome. And that individuals, with drug problems have increased reactivity to craving and drug cues. They see something and it immediately reminds them of using. And also patients who have had addiction-related disorders, may feel a certain symptom like a little hunger pang or maybe some mild sweating. That could be due to just the general temperature around them, but they immediately associate it with withdrawal or the need for more of their baseline medications or to use again, even if it's not really the case. And so there's definitely these adaptations that occur in individuals that can be reversed by using subanesthetic doses of ketamine to correct these neuroadaptations and restore the motivation for non-drug rewards. So rather than me having these sweats and a little bit of hunger and saying, I need more fentanyl, I'll say, maybe I'm just hungry. Maybe I just need to turn the air conditioning on. And so by doing so, we can kind of change the way that we think and the way that we see ourselves. And this is what psychedelics and ketamine therapy can do. So there are benefits of ketamine that we've seen from these studies in alcohol use disorder and cocaine use disorder. And there are other ones for opiate use disorder, which we aren't addressing in this particular article. But it is important, and we found this at Nova Health Recovery Ketamine Infusion Center, that addressing underlying mental health co-occurring disorders certainly makes results more effective if you're using ketamine therapies for craving and cocaine use disorders and alcohol use disorders. That it's important to use traditional medications and traditional approaches, including psychotherapy and behavioral activation, and changing the individual's environment as well as lifestyle and structured time, as well as altering any baseline medications for compliance. And we found that periodic infusions, monitoring for relapse, and again, baseline medical therapy to decrease cravings with traditional medications can be very helpful. So for example, with alcohol, ketamine infusions can certainly decrease cravings and use in a lot of individuals, and that's what we've seen. But it's also important to pair that with also traditional treatments like naltrexone, whether it's injected or by mouth, and of course, acamprosate, gabapentin, Topramax. It just really depends on the individual, but pairing these traditional treatments with ketamine therapies certainly can be quite effective. And meanwhile, you have to also look at the underlying mood disorders. So if the person has bipolar depression or treatment-resistant depression, certainly ketamine helps out with that. But also these individuals may need to have traditional medications to help maintain a better foundation for their mental health. And so stopping all your traditional medications is certainly unhelpful in many cases. The ketamine is a treatment, not a cure. And it has to certainly be used as a treatment. So it does require ongoing care, just like everything else does. And individuals who have addiction disorders, they might have been basically in a situation where they felt fine when they started using, but they can develop mood disorders as a result of using that don't necessarily go away when they stop. And so that said, those individuals can sometimes require ongoing mental health care, even after they've finished treatment for their particular use disorder. And if they've not had any relapse recently, they still may have low mood, post-acute withdrawal syndrome, or whatever the symptoms may be. And so we found at Nova Health that also home-based oral and intranasal ketamine therapies as microdosing can be certainly helpful in the maintenance of neuroplasticity and anti-craving. And we've used this in a number of different directions effectively and also safely. We monitor for use and misuse and abuse of the treatment. And again, the patients receive a specific amount of the therapy. And so there's only a certain amount that they will use per period of time. And again, the last thing is that there is a difference between the use of ketamine in individuals who are depressed versus not depressed, and individuals who have mood disorders and those who are just using it for fun. And we know that the use of ketamine over and over again, basically, there's no true withdrawal state of ketamine in multiple uses, and that it does have a pro-cognitive effect as well, based on studies of depressed patients who have received ketamine multiple times over. So that said, ketamine serves a number of different purposes in addiction treatment. And in particular, it can certainly help with the mood. It can help with depression. It can help with anxiety disorders and underlying bipolar depression, mixed with traditional antidepressant therapies as necessary, as well as cognitive behavioral therapy and any other types of psychotherapy that can certainly integrate the experiences that these individuals have during the time that they're receiving the ketamine treatments and any further ongoing care.